Welcome back, everyone. And thank you so much for joining us for this very special episode in recognition of World Hemophilia Day on April 17th. So, today we're shining a light on a condition that affects more than 1 million people worldwide, yet it's still widely misunderstood. Hemophilia is an inherited bleeding disorder that can profoundly impact daily life, recovery, joint health, and long term well being. Many people may also know hemophilia as the royal disease, and it's a name that it was earned through its association with Queen Victoria's bloodline, which it spread through several European royal families and became a significant part of medical history. We'll touch on that fascinating history before exploring what it means for families living with it today. So, at the Nerve Health Institute, we believe awareness is the first step towards healing, support, and hope. In today's conversation, we'll be exploring what hemophilia is, how it affects the body and the nervous system, and why early diagnosis matters, and what modern strategies can help to support healing, resilience, and the quality of life you have. Whether you are personally affected, or you're supporting a loved one, or simply want to learn more, this is an important conversation that could help bring understanding and awareness to many families around the world suffering with this condition. So let's get right in today's special World Hemophilia Day episode.
Hi everyone, it's Cameron, and today I'm here with Dr. Chris Cormier. Today is World Hemophilia Day, so that is what we're going to be talking about today. Hello, Dr. Cormier.
Hi, Cameron.
Hemophilia is an inherited bleeding disorder and affects over 1 million people worldwide. It is often called the royal disease, and today's focus is on awareness, early diagnosis, and modern support. So for anyone hearing about hemophilia for the first time today, can you explain what it is in simple terms?
Yeah, so basically, it's an inability for the body to produce clotting factors, which, let's say you get a cut and you need to stop the bleeding. You want your body to automatically do that, right? So it's so amazing with our bodies when you think about it. We have all these God-made processes that are built within us, programs, if you will, that are like God-made programs that are built within the body. And we don't notice any problems with any of those thousands, millions of programs until something goes wrong. So you want to think about it. If you get a cut and it just won't stop bleeding, that's not normal. It should stop bleeding. So there's these clotting factors that the body produces or should be producing that basically are just not being produced.
Many people still go undiagnosed until a major bleeding event, surgery, or repeated unexplained bruising. Why is awareness and early recognition so important in 2026?
Well, you don't want to have any catastrophic event happen. So let's just say, you had something that really cut you with a big cut, and you just necessarily, if you didn't know you had this condition, you might bleed out. Or let's say anything else potentially happens. It could just be a big bruise. Let's say you're a sports fanatic and you just have a hit, and you just, next thing you know, you're bleeding out and you don't know it. I mean, so these are things that are so important with this particular condition to try to figure out if you have this condition or not, so that you understand. And again, it's all about like paying attention to your body. So some people will get a bruise and it'll just stay there, right? And it'll take it takes 6 months to heal, and they're like, oh yeah, that's just me. That's just or they'll get a cut and it just takes longer to stop the bleeding, and they don't pay attention to some of the small things and just think it's them.
100%. At your clinic, the Nerve Health Institute, you often talk about how physical, emotional, and environmental stress affects healing. Can chronic stress worsen symptoms and recovery in someone living with this bleeding disorder?
Okay, so let's back up a little bit on hemophilia. Remember, these clotting factors that get produced, they get produced in the liver mostly with this particular condition. And they also get produced in endothelial cells, which are in blood vessels. And so you got to imagine, from our standpoint, we're wondering, like, we're constantly like trying to figure out the root problem. So most people would just say, oh, it's a genetic defect, right? I just have this. My family had it. Generations of my family had it. Well, we're trying to say, why did a family member get it? Maybe in your past generations, there were many generations before that didn't have it, and all of a sudden somebody got it, right? So what happened? You want to think of these production centers that are in the body. Let's just say the liver, for instance, and the liver has these cells that produce these clotting factors. and enable your body to block, any excess blood flow when something gets cut or bruised. Well, if the brain, from our standpoint, we're here at the Nerve Health Institute, just imagine this thing here is your power company, and it's wired to trillions of cells throughout your body. Now, those cells are not just muscle cells, right? Not just bone cells. Can you imagine the brain's wired to every tiny little bone cell, every tiny muscle cell? The brain's wired to every organ or gland cell and every skin cell. So just imagine, okay, the liver is a pretty big organ. Mm-hmm. It's a very regenerative organ. People know it's regenerative, right? And all it takes is a power supply issue to certain cells where those cells can't function properly, and then they get sick. Now, what caused that power outage in those cells? It could be somebody in your past generations that maybe had some type of physical trauma, as you mentioned a few minutes ago. Maybe they got punched in the liver, right? Mm-hmm. Or maybe it was something that happened emotionally, right? It was very traumatic. Remember, the liver is very involved in emotional traumas. And then there also could be like any type of environmental trauma that could happen to your cells, which is massive. It could be a chemical pollutant, toxin, additive, preservative. Somebody could have gotten something inside of them, one of your ancestors, that turned these cells off. And then there also could be so emotional, physical, environmental. So I kind of covered all three of those stresses, but there's so many different things within those categories that can knock the health off in any of your cells. But in particular, with this particular condition, it could just be something within the liver or one of those endothelial cells throughout your body that are in blood vessels.
Repeated internal bleeding into joints can cause pain, stiffness, and long-term damage. From a nerve health perspective, what happens when joints are repeatedly inflamed and damaged over time?
Yeah, so basically in your body, you don't want your joints to stay constantly inflamed. Yep. You don't want to stay chronically bruised, mm-hmm. because that means things are just not healing. It's like slowed healing, right? But you want the body to recover, and you want self-healing to happen. So our bodies, remember, the way God designed us, I didn't design this amazing body that we have. God is the most amazing engineer in history, right? And the way he engineered the human body, in my opinion, is the greatest marvel in the world. And because it's designed to heal itself, and it should heal itself, but all of a sudden you get a particular condition like this that's just not healing itself. And the next thing you know, you got 10 generations of people that have this particular condition when they should be trying to do certain things, use certain resources, focusing in on the self-healing capacity, trying to get those cells to get their health back so that you could potentially reverse this condition.
Sleep is a major pillar of recovery and tissue repair. How important is sleep for people dealing with chronic inflammation, pain, and ongoing recovery from bleeds?
Yeah, so sleep, remember, people overlook the basics. I think most people stay as sheep in a herd and just kind of keep listening to whatever everybody else is doing. If you're eating junk food, if you're, not sleeping properly, if you're doing all the things that people do, chronically stressed all the time, mm-hmm. Using all the Wi-Fi things we use all the time. I'm not saying never use it. And there's so many layers of protection for all these things that people should be doing that people are not doing. And then they wonder, why their bodies crash, right? So it's so important, especially like sleep's one of these major components on a day-to-day basis. If you're just lacking in sleep, then your body, when you sleep, you heal. And if your body's not sleeping properly, it can't heal. So it's one of those necessary staples. And some people lose the ability to sleep, like where they're in the middle of the night and they wake up. And you want to think of your brain, your body, it goes through a checkpointing list every single night. So every single night you're sleeping, there's a full recovery a systematic protocol that your body goes through, and it checks and checks and checks and checks all your parts within your body. That's how God designed you. So when you get to a certain part that's problematic in that checklist, timeline-wise, while you're sleeping, sometimes people wake up. Mm-hmm. And it could be maybe the liver has such a big disconnect, it's waking you up, and people don't realize this stuff. So there's so much involved. This condition's not necessarily like, I wouldn't say something that you could help yourself a lot at home. Mm-hmm. With our at-home protocols and everything. You might need more specific conditions. It's complicated. It can be complicated.
You often say oxygen is one of the body's most important healing ingredients. How does oxygen support tissue repair and recovery?
I can't believe we're in 2026 and we have to have this discussion with people. I really can't. As smart as the world is, as smart as we are,
Yes.
people don't know the number one ingredient in the human body. I can't even believe that, right? We could do it without eating or drinking. You could do it without a lot of things, but you cannot do without breathing. And there's a scientific reason. 65% of your body's elemental composition, right here, should be oxygen gas. And that's why we can't do without breathing. We need it. The problem with breathing is it's complicated, right? We don't breathe enough. We don't know we're breathing anymore. And trying to get all that oxygen in through this process, it gets weak sometimes in your body's transition from getting this air, whatever it is, and trying to get all this oxygen into all your cells at any given time. So everybody, in my opinion, has oxygen deprivation in cells, and that leads to deficiencies, at least to conditions if you don't take care of the cells properly. So we have all these types of oxygen therapies to help restore oxygen, in addition to our Body Chargers platform. Remember, we have Nerve Health Institute. We also have Body Chargers for home. We teach people all these strategies for getting oxygen into their cells, more oxygen consistently on a daily basis.
Well, let's talk about a little bit more daily things. What are some daily habits that you believe will make a big difference in long-term healing and resilience?
Yeah, so basically when it comes to this particular condition, and any condition out there, getting more oxygen, getting better quality water, getting sunlight, those are staples that our bodies should have. I call it OWL, oxygen, water, and light. Those are the basic ingredients. And in this podcast, I'll give you just a little nugget of what we do, right? Even if I just take your liver's on your right side here, so if you just take a soft part of your fist and you tap on top of your liver a little bit, just that little tapping is going to get recognition from the brain to the liver. And sometimes that little tapping, the body will say, whoa, is my liver connected? Just now when I just did this shouldn't be tender at all. It should just feel like a tapping wave, but some people, they'll notice tenderness there. And a lot of times that's a disconnect where that organ has lost connectivity. But just the act sometimes of doing this particular stimulation can help connect the brain to the liver, which could help clotting. I mean, it's such a simple thing sometimes the body can do, or for repair. And you just have to know these ways that we think about the body, and it's more deep rooted. But it goes back to God's design and how He designed it, and then how to be able to fix things.
Conditions aren't usually just about the person or the patient. Families often need support and education as well. What should parents know if their child has been diagnosed with hemophilia?
It's something not to play with,
Yeah.
right? You don't want to play with, especially kids. I mean, they're so. I mean, my wife and I have 3 kids, and they're so athletic. If they're athletes, and they're even without even being athletes, I mean, they're on playgrounds and they're falling and twisting and bending, and I mean, a lot of times they're fearless, right? So, in this particular condition, you definitely want to make sure if your child has bruises that aren't going away, if you start noticing they have a cut, it takes longer to stop the bleeding. I mean, you definitely want to pay attention to these things. And if you want to go conventional, certainly that you can offer, you can go to the conventional route. But on our side, we offer many alternative holistic approaches to being able to help the body, but deep rooted, trying to change the course of genetics.
From the perspective of the Nerve Health Institute, what is the most important message you want people to take away this World Hemophilia Day?
Yeah, so the human body is the most powerful thing created in the history of the world. It has the full capacity to heal itself, and that's called self-healing. But you got to do the right things. You have to use the right resources. I can't even tell you how many things I've overcome, how many bad genetics I've overcome throughout the course of my life, which is changing the course of my kids and generations coming within my family. So with these types of conditions like hemophilia, it just involves thinking outside of the box and doing some things that are different than what conventional is teaching you.
Well, thank you very much, Dr. Cormier. That does conclude our talk for today.
If this podcast spoke to you, or if you feel like you have family members or friends that have these types of conditions that could benefit from this particular technology, then all you need to do is become a Body Chargers member or tell them about Body Chargers. Remember, it's our community that I created to help people at home with the best technologies in the world to be able to help you to self-heal your body at home and maximize your self-healing. So Go to Body Chargers, become a member. That's the easiest way to get this done. And we look forward to serving you and your family. Also, if you want a higher level of care, we have the Nerve Health Institute you can always come to. That's our clinic where we have higher level services here to be able to help you. So I hope you enjoy, and we look forward to serving you and your family, and look forward to our next podcast.